So welcome to the Lead Change podcast. I'm so excited to have Dr. Antonia Chen here as our guest today. Dr. Chen is a professor of orthopedic surgery with tenure, and she holds the Charles F. Gregory Distinguished Chair in Orthopedic Surgery at the University of Texas Southwestern. She was an associate professor at Harvard Medical School and the chief of arthroplasty and joint reconstruction at Brigham and Women's Hospital. She was previously the director of arthroplasty research at Brigham and Women's Hospital as well. Dr. Chen received her BS from Yale University and her MD from Rutgers Medical School, where she graduated with distinction in research and was inducted into the Alpha Omega Alpha Medical Honor Society. Antonia received her MBA from Rutgers Business School. She completed her orthopedic residency at the University of Pittsburgh and her fellowship in hip and knee arthroplasty at the Rothman Institute. She is a member of the Knee Society and the first female surgeon in the Hip Society. Dr. Chen has authored over 450 publications, 45 book chapters, and 4 books. She has won multiple research and mentoring awards and has presented all over the world. Absolutely incredible accomplishments. I'm excited to be here with you today, Antonia. And I was thinking actually in leading up to this interview about when we first met. I think we wonder, like, when did we meet? So as far as I can remember, and please correct me, I think the first time we met was when I was an examiner for the mock oral boards in Washington, D.C. And Antonia was there as an examinee getting ready for the oral boards, which was the following month. So that was fantastic. And we have had so many interactions and opportunities to work together since then. And although we're in different specialties, so, a total joint surgeon and sports medicine surgeon, we interact frequently through our orthopedic societies and organizations, through the Journal of Bone and Joint Surgery. I have really enjoyed watching all of your success, and I'm really looking forward to diving into some of the details as part of this podcast. So welcome to the podcast.
Thank you so much for being here, and thank you for being a mock examiner for me. I was just talking about you actually yesterday because people are getting ready for boards and stuff like that, and they're like, "What should you do?" I'm like, "You should talk to Mary McCahey. Dr. McCahey is amazing. She's the one who got me to pass my board, so thank you."
Oh, that's very kind. It was really fun, and I think a hugely valuable experience for anyone out there getting ready for the boards, whether it's within or outside of orthopedics. Like, practicing and taking advantage of opportunities to do that preparation is hugely helpful. Before we dive into some specific positions that you've held and lessons you've learned, Antonia, I wonder if you can start off by touching on your clinical practice. So not necessarily your specific position currently, because we are going to talk about that in detail, but your clinical practice, and highlight your areas of expertise and your specific interests.
So I'm a hip and knee replacement specialist. I do right and left knees. I do primary and revisions. So we do have a little of a compendium and a little breadth to what we do, but everyone always says you really just do hip and knee replacements. But we do a full compendium. And I also do robotics. So robotic hip, robotic knees, partial knee replacements as well. Obviously, like stuff for trauma as well too. I do take trauma call, but that's my area of interest in the technology field, as well as doing primaries and revisions.
That's awesome. How do robotics fit into your practice? Is it a specific type of patient, a specific, knee versus hip? I mean, I don't know. How does that work? And I didn't have any experience to that when I was a resident, and I don't feel like I was a resident that long ago. So.
No, it's interesting. I learned it all post-residency and post-fellowship, actually. There was no robotics in fellowship. There was navigation in residency, and that was an interesting tool to use. But I grew up in the manual world, so I use it in every primary and every primary hip and knee replacement patient. I've started using them for my revision hips, which is really great for cup placement. So the nice thing about it is I have a lot of manual skills from before, so I know exactly where things should go, but it helps me execute exactly what I want to do. So for example, if I want to add 1 degree of slope, for example, as a human being, I'm probably not going to add just 1 degree. I'm going to add up 2 or 3 or 4 degrees, right? But with the robotic system, I can dial it in. So I use it for all my patients. I used to use it for specific indications at first, but I said, well, if the results are good, why would I not use it for all my patients? So I switched to using it for all my patients now.
That's awesome. And I think it's a fantastic example of how your techniques have evolved over time, and that even when you're done with training, you're not done with learning. We're learning every single day, regardless of what specialty of orthopedics or in medicine in general. Like, we're continuously learning. And so I think it's like the willingness and interest to learn and be up on technology and innovation, newest techniques within your field is hugely important. So that is fantastic. And even though I don't do that, I enjoy hearing talks about that. And I'm so amazed because I think even 12, 13 years out, it's incredible how much things have changed, like since I was doing these types of things as a resident.
Well, my sister had her ACL reconstructed, and she had a, transtibial ACL, and now like that's a bad word, right? So it's so interesting to see what has changed over that time too, even from a different part of the field and things like that. So I also find it very intriguing and interesting. Obviously, in sports, you see it a lot in athletes who are, getting surgery and stuff like that. So it's a little bit different,
Yeah,
but it's very, very cool to see.
it is. I mean, we see a lot of evolution. I'm definitely doing things in sports now that I had no exposure to as a resident or a fellow. So definitely, we really need to be up and willing to like learn and learn techniques and practice and learn from each other. Uh, so, transitioning a little bit, you recently had a big change in your practice. You transitioned from Brigham and Women's Hospital to UT Southwestern to take over as department chair. So, huge, huge congratulations on that. That is such an enormous accomplishment. And for our listeners out there who may not necessarily be aware, there are about 150 plus orthopedic surgery residency programs in the United States, but only about somewhere around 11 maybe have women as department chairs. So yeah, that is an amazing accomplishment. And I'm curious, Antonia, so how and maybe when did you decide that you wanted to become a department chair? And which I think most people listening are going to know is the highest level of leadership in an academic department. And as part of that, what leadership skills do you feel like were necessary to really help facilitate a smooth transition?
So it's very interesting. I actually didn't anticipate to be a department chair for another 10 to 15 years if I was ever going to get that opportunity, to be perfectly honest. It was one of those things where I started in the world of research. That was my interest first. So I did a lot of research. I did it at the Rothman Institute, really enjoyed it, was hired to be director of arthroplasty research at Brigham and Women's Hospital. And while I was at Brigham and Women's Hospital, one of the biggest things I wanted to do was make changes. And in a position of research, you can make changes in the research division, but you can't make changes in how the OR works or how the joint division moves or things like that. So I became interested in leadership because I wanted to see change. So I used to, in medicine, we're really good at complaining. And I'm totally a culprit of that as well, right? So I go, instead
Yeah.
of complaining about something, why don't I be the solution? And I don't get everything I want. I can come up with ideas and people are like, well, that's a terrible idea. And I'm like, well, okay, at least but if they let you implement it, then you put on the work that goes behind it. So a lot of the things that I've done in life, I have to admit, have been cumulative to this point, right? And at the time, I didn't know about it. So, example, at Rothman Institute, we started the Rothman Orthopaedic Specialty Hospital, right? And that was kind of like a small hospital in terms of very few beds, a lot of outpatient surgeries. Really try to push the envelope in a way. And this was 10, 12 years ago, right? So a long time ago that they were forming this. At the time, I was like, okay, as part of these formulators, like, how do we bring blood in if a patient needs transfusion? Well, we're talking about those things now when we're developing ASCs. And so individual skills that came along the way became really helpful. With joint replacement, one of the big questions I got asked with regards to leadership is how do you work with people? And are you used to working with different people? Well, in the world of arthroplasty, we have older people, we have younger people, and we have people, literally there's 9 of us, and we have all 9 different opinions. And so from a leadership perspective is how do you mitigate that? How do you build consensus? How do you drive change by bringing together individuals who are very different minded into the same goal? And so even in a small division of 9 people, I was able to use those skills and translate it into the chair role. But to be perfectly honest, again, I wasn't planning to be a chair at this point in time. Honestly, when I got the phone call to be chair, I was like, are you sure? I didn't think it was going to be me. So I like the idea of share at some point in time because I wanted to be able to affect change. That's really the big thing. And one of those things that comes with affecting change is having the energy to do so. So while thinking about it more and more, I was like, you know what? This is a good time in my life because I do have the energy to make that change. There's some programs out there who really don't need a lot of change, right? They're coasting, they're great. They, have it all put together really and just have to maintain the status quo. But UT Southwestern was a unique opportunity to say that this is something I want to do. And the leadership wanted to see that change, which I think is the second aspect of it that I don't have control over. When I was at Brigham, there was a few things that I wanted to do. If, they had a merger between Mass General and Brigham.
Right.
And I said,
Yep.
in this merger, I would love to bring all the arthroplasty surgeons together. We all get along well, put us in a hospital and just let us do a lot of joints. We'll create a center out of it, the big center of excellence. We'll take great care of patients. And the leadership just said, not our leadership in orthopedics, but the hospital leadership above us said, yeah, we're not going to do that. And so that's the other part of leadership is timing. Some skill sets that you've picked up along the way, and watching and learning from other people was probably the biggest thing for me. We've all had chairs before, and there's some things that we like what our chairs do, and we don't like some things that our chairs do, or other people in the field, right? You're like, I want to emulate that because I think that had a good impact, but I didn't really like that. So watching and learning has been the biggest thing with regards to my leadership journey, and then people who supported me along the way and encouraged me, which is really nice.
Yeah, that is amazing. And you touched on some things that I definitely want to dig into a little bit deeper. So in making this big change, what are some of the lessons you've learned as you've become a new faculty member at UT Southwestern, right? Because you're not only department chair, you're there, you're practicing, you're doing total joints, you're in it with the rest of the group. So what have you learned as a new faculty member there and starting there in this very high level leadership position?
I've learned that people management is the hardest thing to do. So, unlike hip or knee replacements, which are a little more predictable, people are not predictable in any way, shape, or form. And nothing prepares you for that, in all honesty. I was actually talking to someone recently about this. I did my MBA between my first and second year of med school, so really early on. And the class that I totally blew off was managing people. And now looking back at it, I would go back and take that class 10 times over because
Oh
I think that's
man,
the
yeah.
most important thing. So I've learned that a lot. I think there's managing expectations is one thing, two, understanding people, and three, listening. That's the most important thing I've learned is to just listen to people, especially as an outsider coming into a new facility. It's easy for me to come and said like, well, back where I was, we did it like this, or we should do it like this because I say so. But you're not respecting the culture and the history at that point in time. So I spent a lot of time listening for the first 6 months, I would say. First 90 days is what they always say is the first time to really get to it. We did make some changes right off the bat, honestly. And there were some changes that I made that people said you probably shouldn't change it in the first year. But I thought that we needed to change those right off the bat. Things like compensation, things like that. So it's been an interesting learning journey, I say. Still learning, and it's every day is something a little bit different, but it has been quite good.
Yeah, those are really some incredible points. I love that you say, like, if I could go back and take that one class again, I would do that. I think it's very interesting how a lot of people are getting their MBA, and there's so many different points in your career where you could do it. So it's valuable to get your perspective on, doing that between first and second year. And you did take first and second year of medical school, and that you took a lot of valuable lessons from that. But then now, in your position, you realize there were some other important things that maybe you didn't take advantage of. And so that's certainly something we can share with the younger people who are looking at getting that extra training. And I also love that you commented on the whole idea of like the culture of the institution and understanding what they're doing at their institution and how that like the different valuable aspects of what they're doing in the OR or the clinic and how that may mesh with what you were bringing from the Brigham or from your previous experience from Rothman. And respecting everybody's opinion. Like I love that. I think that's so important. And definitely, I mean, I'm sure it had a huge impact on how you were received at UT Southwestern.
It seems to be people I feel like have received me well. Now you got to ask them, not me. It's always one of those tricky things where you're like, I think I'm doing okay, but you don't actually know if you're doing okay. But it seemed to be quite well. I think they appreciate everyone being listened to. So I've sat down with every single faculty member when I started here, one on one, to understand the goods, the bads, and what we could change that for, what changes we could make. I also sat down with the residents. I sat down with each class and listened to each one of them and said, what's important to you? What do we need to change? And of course, what they're interested in might be a little bit different than what the attendings are looking for. I sat down with the staff as well too to understand them, and then sat down with some of the other staff that were adjacent to us. So we have central schedulers, for example. I sat down with them and said, okay, what do we need to do in orthopedics? How can we make this better? And just sitting down and listening to everyone. These are big hospital systems. There's one person in charge of security, but that's like IT security, and there's one person in security for the door. Like there's someone for everyone and just for everything. And part of the beginning was just kind of getting a lay of the land, understanding things. And so I don't come in as a threat. I come in as trying to really absorb and understand to make the changes there. We even had a faculty retreat just a few weeks ago where, it's called Bring Out the Good, Bad, and Ugly. What do we do well? What are our strengths? But what are our weaknesses? And most importantly, what are our solutions? Because again, in medicine, we can complain all day long, but if we don't find solutions and implement them, then we're not taking advantage of what we have in front of us.
Yeah, that is fantastic. It must have been a great experience too to have everybody together in these different meetings, but also this recent faculty retreat. So congratulations on making that happen in just a year, right? When did you start at UT Southwestern?
September 1st.
in
So it's been
September.
a,
Gosh,
a
that has gone
whirlwind.
fast. Yeah.
It
Yeah.
has. I will say it was
Um,
a Saturday afternoon, so I gave my faculty a lot of credit for coming in.
no, that's great. I'm sure they were happy to, right? It just shows commitment to what everybody's trying to build in the department. So that's fantastic. Um, what are some additional leadership skills that you feel like you've already developed being in this position for, I guess quickly approaching a year?
I think two things that I would pick up is decisiveness. So I have to admit, myself, ironically, I was a surgeon. I can be decisive in the OR and say we're going to do this. But when it comes to people, like I don't like, I'm a people pleaser. I admit that. I don't like disappointing people. But in this role, you do have to disappoint people. And as long as you give a reason for it and a good reason for it, then it's okay to execute it, for example. Right. So like we restructured our research division, for example. And it just seemed like it didn't seem to flow well, didn't work well. But that because of that, some people had to be let go. And that's really hard. No one likes to let go of people. And the second you do, it's not a good role to be in, right? I don't enjoy any of that stuff. But understanding that this is a decision that needs to be made and it's going to affect some people. But what can I do to help those people move and do other things? But having to make those decisions was one thing. And two, building consensus. That is always an interesting one and the hard one to do. But I've learned more so to do so, call, pick up the phone. This is something that Dick Rothman taught me actually. Pick up the phone and talk to them before the meeting. Get their take, get their insight and things like that. But call every individual person who's going to be on that call so that when you get to the call, nothing's a surprise.
Yeah.
Now, there still might be surprises, let's be honest. But most of the time, it has hit the point where it's not as surprising. And so it has built consensus in a good way.
Yeah, that's great advice. Really important lessons that you've learned already. So, so you are serving in some other very impressive leadership roles, and we are definitely going to touch on those. But before we dive into those things, I wonder if you can share a little bit about really what drives you, right? What drives you, and what's your primary motivation in what you do every day, whether it's at UT Southwestern or in AUKUS or other positions you're in? Like, what is your main motivating force?
I would say there's two of them. My first main motivating force is to make change, to do something different, to make an impact. And that's probably the main overarching thing in my life is that I don't want to be status quo. I want to do something and hopefully if I touch something, hopefully make it better. I may not make it better, but I hope to make it better. And in that same vein is opening up the doors for women in orthopedics. Arthroplasty is 2.6% women. It's very tiny. And so the more doors I can open for women in arthroplasty, but in orthopedics in general, or medicine in general, honestly, but mostly orthopedics because we have such a small percentage, that's
Yeah.
part of change and a change agent. But that's really what drives me.
Yeah, that is fantastic. And I see that. I mean, I see that in everything that you do. That's awesome. As you look at your career and the many experiences, many leadership positions, et cetera, you've had, have there been specific like pivotal points or pivotal roles that have really helped shape you as a leader?
I would say yes, is the short answer, but not always successful, I will say. I think sometimes our failures can actually shape us into stronger people. And so my first job was Rothman Institute, and I thought I was going to stay there for the rest of my life because most people, when you start a job, that's just where you're going to stay forever. Now, we know the statistics are over 50% of people leave their first job, but I didn't think I was going to be that statistic. And so I was, in charge of arthroplasty research at Rothman Institute, which gave me the tools to run arthroplasty research at Brigham, which was great. But there were a lot of things with the system and the setup and the individuals there that just I didn't mesh with them. And so it made me question a lot of what I wanted to do or if I wanted to continue in the world that I was in and if I was good enough for it, honestly. But being able to transition from a place where I felt questioned to a place that I felt I could build something. So at Rothman Institute, there was already a research infrastructure that was already built. When I got to Brigham in arthroplasty, there was no research infrastructure. So I took what I learned from residency and fellowship and my time at Rothman Institute and built the research infrastructure at Brigham for arthroplasty. And it gave me that confidence that said, okay, I can do this. I can change, I can move, I can pivot. So that interestingly enough was probably the most pivotal moment for me with regards to defining my career, and being able to take on challenges and know that even if I don't succeed, it's not the end of the world. You can pick yourself up. Not everything is going to be a knockout out of the park success, and that's okay. So that was probably the most pivotal one for me. And the second one was being a director of arthroplasty at Brigham, just because it gave me that confidence to say, okay, I can do this. So that was it. Those are the most pivotal, though, was not doing a great job, I guess, or questioning myself, and then realizing that there was a lot more beyond that.
Those are excellent points, and I think that part of it is like it's not failure. I think our mission, vision, goals, values can change as we go through our career, and that's what happened to you too. And you had different opportunities, and you had developed these skills, and you had the opportunity to really implement them in a different location. So I wouldn't consider that anywhere near a failure, but really a huge success in a building, sort of building part of your career. But I think it's a really valuable point that we learn from all of these experiences, and that you wouldn't be where you are now if you weren't at Rothman and Brigham, right? And now UT Southwestern. So really that's huge to just build and see the success and what you learn from sort of the pros and cons of every situation. All of this too has contributed to your leadership style, right? And so how would you describe that? And in what ways do you consider that to be really effective?
So kind of what we said before about what I liked from some people and from some other people I didn't like, it allowed me to learn from different individuals. And so my leadership style is very inclusive. I like to get people's opinion on board. I like to change the status quo by having input from others. So the retreat's a good example, right? I wanted everyone to get together and say, okay, these are the things that need to change. I want to change. And some of the things I probably wouldn't have put on my list, right? But it was important to people, and then we voted on them, and then the ones that had the highest votes are ones that we're going to take as action items. And so I've learned leadership style for me works well, and what I've seen people is bringing people together, being collaborative, and then wanting to change together, right? So that's the other thing too, is getting behind a mission and vision statement that works. So we wordsmithed our mission and vision statement because that hadn't been looked at in honestly ages. And so, is this what we want to do? Is this what we're striving for? How do we do that together? Because if you don't have buy-in from everyone, then people are not going to want to work on it. Academics is a weird world, right? We're asked to educate the next generation of individuals, but there's not necessarily an incentive for that, right? Or do research, and there's not necessarily an incentive for them. It takes a very different individual to want to be in academics. And so how do I encourage that? And I think one of the things that people will say, it's time, money, and control. Those are big things that happen. There's only so much money in academics. We all know that. And there's only so much time that we have, right? But control, can I have them control certain things and say, okay, this is what I would like to see. This is how I want to see improvement. And by empowering people to make decisions together, that's what I think for me, my leadership means a lot to me, and this leadership style that I like to engage in.
Yeah, that's like really effective. That's fantastic. And I'm sure the faculty really appreciate that you are genuinely interested in their opinion. And I don't know if you've ever read Start with Why by Simon Sinek, but I love that book, and that has been really one of the most impactful leadership books that I've read. And it speaks to a little bit what you were getting at, right? So it's where you start with the purpose, right? What is the collective goal? And when everybody understands that and has buy-in and is willing to work towards achieving that, right, you're so much more likely to be successful as a group. So it's really critical to understand the purpose and sort of the mission, the underlying goal of what you're doing. That's exactly,
He's got a great YouTube video too.
Yeah, right. Fantastic. I know. So I wanted to touch a little bit on some of your other leadership roles. In addition to serving as department chair at UT Southwestern, you were previously the president of the Musculoskeletal Infection Society. So what did it mean to you to serve in that role, and what were some of the kind of key changes that you were able to help implement?
So that was interesting because they approached me and they say, would you like to be president of Musculoskeletal Infection Society? And I go, I feel like I'm a little young for this. And they're like, well, you've been with this organization, for I think it was like 6, 7 years at the time, and had been very active and participating. And they're like, and we think that you're very passionate about this topic. And I go, I am. So when I was approached for it, I was kind of like surprised and taken aback. But once I was able to be in that role, that you start as a vice president, and you work up to president, which is really cool because you could see the organization. I think two things became very apparent. One, actually three things I would say. One was succession planning, right? To continue the pipeline of people who are interested in this topic. Two, getting the word out. People just didn't know the Musculoskeletal Infection Society existed. And I think still to this day, it's still, a smaller society for that reason, but really getting the word out. And three, our organizational structure. Up until then, it's still pretty grassroots. But one of those things is we didn't have our own executive director or our own executive, I guess executive director is probably the best way to put it, organizer, for example. And so we were sharing ours with another society. And I think that at that time it felt better if we had one that was dedicated to our group. And so I made that part of my mission to make that so that we could focus and have someone dedicated to everything that we were doing. And so that was during my presidency. That's what we did. But it was a really eye-opening experience on leadership, how to serve in these governance boards, what it's like to go through the ranks and see the years go by, and then changing some things, right? So like we ran the national meeting one way. What if we do it this way or do something a little bit different? And so some changes have persisted, like the executive director that started when I was there is still there now, and she's excellent. And some other changes, people have taken their own flavor on the national meeting, so that's been also good too.
Yeah, yeah, that is so great. And I mean, you bring to that position your experience from other leadership roles, and then you take from that too uh, some good leadership lessons that you can bring to your position as department chair and other leadership roles that you're in. So it's really great to hear about things that you were able to implement and help change, and some changes that have stayed in place. And so it's interesting to kind of see how that process works. The final really significant leadership role that I wanted to touch on is your current position within the Association of Hip and Knee Surgeons, or as we say in orthopedics, is AUKUS, because we have all our acronyms. But
So
you're
many
currently
acronyms.
you're currently vice president, and you will be only the second woman to serve as president of that society. So congratulations. So excited for you. Can you share with all of us what are some of your goals for your society as you progress, as for the society as you progress through your year as first vice president and into the role as president?
So I'm still developing what my platform will be. I know I have a year in order to do so, but I think one of the biggest things and what I'm so excited about being the second woman in ACUS, and the previous woman, Mary O'Connor, was a tumor surgeon and I'm an arthroplasty surgeon, so a little bit of difference there. But to really use it as a platform to bring awareness to ACUS, bring awareness to the women in arthroplasty. They let us, Craig Della Valle actually was president the year that we were able to form the Women in Arthroplasty group. And that's due to Dr. Linda Suleiman really making that a reality and bringing it in, and him supporting it, right? That's a big thing. And I would love to be in an area and a time where we don't need a women in arthroplasty group. Like we don't need a committee on that, right? Just because there's just so many of us, it just exists in part of it. So I think maintaining and increasing membership with regards to a mix of individuals that we don't typically see in arthroplasty. One of the things that was really interesting to me in the women in arthroplasty is all these women who came out of the woodwork who've been practicing arthroplasty for 20, 25, 30 years, but never joined ACUS because they didn't feel like it was a place for them or a spot for them. So I want to know that it's a spot for not just women, for underrepresented minorities, for anyone individual who does arthroplasty and can do 50 hips or 50 knees a year, or 50 joints a year essentially, which is not necessarily a super high number, and you can join our membership. So, inclusive membership, it was what I would say, and setting the tone, that as the premier organization that does hip and knee replacements, that we will set the bar when it comes to research and education. Some of the things that we're discussing are potentially creating a new education course, and that would allow us to do education for fellows. Like most of the time, it's for residents or students or things like that, but we don't focus on fellows a lot. I don't know what ASSM or Anna does, but we don't have a fellows course, right? And
Yeah,
fellows are
yeah.
such a big part of what we are. And so, can we do that? Can we develop that and bring that to the next level in that way? So, education and then research. I like big collaborative research projects, collaboration being my mainstay with my leadership, but also with research as well too. They've created a fair grant. They've created some multi-institutional groups there. But can we do this in a bigger scale with regards to some of the questions that we have in orthopedics that we don't get answered in one hospital or two hospitals? And I think a lot of times with our networks, it becomes the same institutions over and over again. How can we break that up? Can we make it so that you encourage other organizations or other hospitals or other systems, maybe not academics, to do research, to participate, to collect data on their patients, so we get a huge variety of patients. We have AJR, which is the American Joint Replacement Registry, which is great, but it's truly just a registry. If you're actually studying and doing an intervention, can we include people that are not normally in the typical groups of individuals that are contributing to studies, and see if that can actually take things to the next level?
Yeah. That's awesome. I can't wait to see how that all comes together. And I mean, I joke, but this is actually quite true. I get like all of my updates on social media, but I follow AUKUS, I follow women in arthroplasty. I see all of that stuff. And you touched on this a little bit earlier in our discussion about the very small percentage of women who are in arthroplasty and among all the subspecialties, right? Definitely like, the Hip and Knee Society and just arthroplasty in general has one of the smallest percentages of female surgeons. But I have been so impressed with what AUKUS has done and women in arthroplasty, and I feel that difference that's being made. So I'm excited to see how that continues forward as you are in your first vice presidential year and into the presidency. So excited to see you keep that momentum going.
I appreciate it. I get my news on social media too, by the way.
Very good. I'm not alone. See? No, I think it's great that I get all the information there. You touched on this a little bit earlier in the conversation, although we didn't go into specifics. But I am curious, we all work with leaders who we admire, we see things that they do, we respect them. And then there are some leaders that maybe you just don't quite connect with. And I wonder if you could comment on that group. And no, of course, no need to name any specific names, but for those people that maybe you didn't quite connect with, or their leadership style didn't resonate with you, what did you take away from those interactions, and how has that helped you shape your own leadership style and how you approach working with different teams?
Leadership is very variable. And I think what I've found is that certain individuals respond to certain leaders in certain ways. So every leader that I've encountered have had people who like them and don't like them. And that's just true in life, right? Not everyone's going to like me, and that's okay. And so what I took away from leadership, the people who I maybe didn't want to emulate, is I got to see who they connected with and to understand that. Because if I understood who they connected with, then my leadership style might need to be more like that person when I wanted to connect a certain type of individual. So, for example, someone who's very dominant, and it's like, this is the way it is, more dictator, like a dictator.
Dictatorial? Yes.
Dictatorial. Thank you. That's perfect. What's more like a dictator? But for some people, that really works for them, right? And I see also them respond. Majority of people not necessarily did respond, right? So I'm the type of person, again, who likes collaboration, but I saw that and I learned, I say, okay, well, some people are going to need that in their life. For example, if I sit down for my one-on-one for a faculty evaluation and be like, you need to do more X. And for some people, that's like, absolutely, that's going to put on my list. I'm going to go do that. But not everyone responds to that, right? If I told that to someone else and they said, you need to do Y, and they'd be like, no, I'm not going to do that because you told me to do so. And so maybe watching people, watching people who I maybe don't necessarily love their leadership style, doesn't mean I can't learn to implement some of those tactics to work with people in certain scenarios. And so I feel like there's always something we can learn from people, and we like what they did, and we don't like what they did. And I can say my faculty will say the same about me. There's things they like about me, and there's things that they don't like about me that they would take along as well too. But that has been something I've learned from watching people as they're in a leadership position. And the same is true for like speakers or people who run organizations. I've been able to just watch and learn. I think observation is probably one of the most powerful tools that we can have, and then emulation, and then creating your own style.
Yeah, yeah, I love that. I love how you summarized and brought all that together. But I think key point here is that we can learn so much from all the leaders we work with, like those that we connect with, those that we don't necessarily connect with, but really important skills that we take away and then develop our own style, as you said. And that's what we implement. And then some people, exactly, some people will connect with us and some people won't. I'm curious, in your career and as you've been in all these leadership positions and as your leadership style has evolved, have there been any specific leadership skills training type of activities or courses that you have participated in that you've maybe found particularly helpful?
So the short answer is no. And I think that's a huge dearth in what we do as in orthopedics. I think that we can, like, no, I did AOA, like Emerging Leaders Forum, that sort of stuff, but it doesn't really give you the tools, honestly, to get to like, what you're doing, what I'm doing now, like what we're doing now. I think a lot was from just trial and error and learning from others. I know there's a lot of leadership courses available now, which are excellent. My MBA, I did not do a good job of using that as a good leadership course because I think there could have been opportunities there. So I'm actually going to an AAMC leadership course for chairs and department chiefs and things like that
Nice.
in October. And so it's in Austin, Texas, so it's not far away. It's gonna be my first kind of true leadership course. But I will say something that's actually really helpful when I started in this role here. UT Southwestern did a really good job by offering me a a coach for the
Oh,
first
that's
6 months
awesome.
of my time here. So I met with a coach on a monthly basis, just talking about the ups and downs. And it was someone outside of the institution, and that's key, I think, because then you can talk about the institution without feeling concerned about backlash or other things like that. And I've extended it for another 6 months because I think a 12-month time frame with this coach would actually be very helpful. But there's a bunch of things that they said. There's two things that she has said recently that has really resonated with me. One, she said, everything or all the skills that you use to become successful and to where you are today may not be the skills to make you successful in this role. And that's a really good point because obviously I want to build on the experience that I've had, but it's different, right? Being a successful surgeon is very different from being a successful leader per
So
se.
different. Yeah.
And then the second thing she says, you need to learn to what the things that you need to do. So it must fall to you. What can you delegate and what can you delete? And so those three things, I think, as in our lives, as we get busier and busier, there's some things we do have to say no to. And I'm not good at saying no because I spent most of my life saying yes. And so she said, do, delegate, or delete. So those are good things for me to hold on to.
That is amazing. And I love how concise it is. And as surgeons, we're like, yes, we can
Yes.
do that. Like, do, delegate, delete. I'm going to implement that too. That's fantastic. And I really love that you brought up the idea of a coach. I was going to ask you about that specifically because I think executive coaching is absolutely phenomenal. And I have worked with a coach for 7 years. Love
Wow.
her, and she has been a huge had a huge impact on my career, and at some point I'm going to have her on this podcast too. So I'm glad that you brought it up, and I hope that others will consider it because I do think it could be hugely helpful.
Yeah, people
um
think it's a crutch or like therapy, and I'm like, it's a very different world.
oh,
It's
it's so
someone who's
different.
it's so different and
Yeah,
so impactful.
it is because the coach, they come with an incredible experience. They
Yes.
really, I find the coach, she's able to kind of distill like our thoughts, our kind of goals, and really just like help focus a little bit more, right? We have a lot of ideas, we have a lot of things going on, and so I find it hugely beneficial. And I tell everyone, and I encourage everybody to consider doing that. um, I wonder, can you share what do you think are some of the skills that are really important to be successful to be a successful leader as a female physician?
So I will say being a female physician nowadays is interesting because the percentage of women going into medicine is over 50%. Most classes are over 50%. So there's not a dearth of women in medicine, but there's a huge dearth of women in leadership. And so there's multiple ways to go about this. So if I just look at my own career in medicine, I played the games that the guys did. And so, what does that mean? It means that I saw guys who published, were on the podium speaking, got promoted, they got asked to do different roles, they asked to do other stuff. So I said, I don't want handouts. I was like, I'm just going to follow that pathway. And I like research, so it works out very well. Not everyone likes research, so I totally understand that. So as a woman in medicine, we are still the minority in leadership. And so I would say, whatever you do, whenever you're given a task, knock it out of the park. When I was asked to give reviews, right? Like do a really, really good job reviewing. That's how I ended up in JBJS. The reason I did JBJS is because I literally did hundreds of reviews. And after a period of time, they're like, oh, she does a pretty good job reviewing. She must pretty be good at this. And then gave me a role, right? Even with AUKUS, right? Like I started in multiple different committees. I started as a third year resident actually, and the membership committee. They actually created a role to say, hey, let's encourage more members to join AUKUS in their residency. And so they gave it to me, and I worked hard at it because that was the role they gave me. I thought it was important. So every role you get, if you do a good job of it, which you will, then you'll get more responsibility and you get more responsibility. And as long as you keep doing a really good job at each one of those roles, then more will come. Now, do you want any of these roles? Not necessarily. But as a female, as I say, female surgeon, female in medicine, there's sometimes more scrutiny on us. And, if we don't do a good job, then they won't allow another woman to take that role, which makes no sense, right? But we represent a lot. So whenever you do it well so that it helps the women behind you. And also the other thing I say as a female surgeon is lift up those who are behind you. That's an incredibly important thing I see. I've had male mentors, I have female mentors, and I appreciate both of them. But I will say that having our women help each other out can make a really big difference.
That is a really, really important point because we need to work together. Like we are much, much stronger together. And so being in the positions that you're in, me having some opportunities, right? I think we're both always about thinking about people around us, what opportunities we can give to them and how we can bring everybody up. And it just makes such a huge difference. I will, as we're nearing sort of the end of this, I want to ask you, What is your superpower, Antonia? Meaning, what is one of your biggest strengths that you feel like really contributes to your success and sets you apart from others?
I'm a huge multitasker. And people have said that multitasking means you do nothing well and you just do everything badly, but you do them all at the same time. I can listen to two webinars and participate in them at the same time. And so it doubles my time in some ways. It's psychotic. I totally understand it. I thought it was just something that everyone could do. Like I'll operate and be on a webinar and then have them like unmute, mute, unmute, but still, walk the resident through the case and things like that. And people are like, no, that's not normal, Antonia. So multitasking is I enjoy it. In fact, one of my residents called me out on it the other day. He goes, "You have to be multitasking at all times." I'm like, "Yes." So he's making the cuts. I'm cleaning up osteophytes or putting an injection in. We're just doing everything at the same time, just to for an efficiency standpoint. So I'm a big multitasker.
Yeah, I love that superpower. Uh, and then, this podcast is Lead Change Podcast. I wonder, what does lead change mean to you?
Lead change to me means be the change. You want to be the one doing it, not telling others to do it or complaining about that it's not happening. But leading change is being there in the forefront saying, okay, I see a problem and I'm going to do something about it because maybe no one else will, or they don't see the problem. And you have the power to do so. Even if you don't think you do have the power to do so. And that's the power of networking. It's the power of believing in yourself. It's the power of believing in others and to work with others to make that happen. So lead change means be the change to change the next generation, to change what we do as a status quo. There's so many things that we can change and will continue to evolve and change.
That is fantastic because that's how things actually happen. So a couple of final questions for you. Do you have a favorite quote?
Uh, this is not the nicest quote in the world, but Eleanor Roosevelt, I think, is the one that says that there's a special place in hell for women who don't help one another. And I really believe in that. You have to help one another. You have to lift each other up. And I know that not everyone does. I get that, but that's a quote that resonates with me.
Yeah, that's really fantastic and so true. And then last question is, are there any leadership books that you've read that you have found to be particularly impactful that you'd recommend?
So because I switched jobs and started this new job, which I was, to be honest, I had no idea what to expect. I was gifted the first 90 days. And I will say that job, if you're ever switching jobs or switching something in life, but the first 90 days was really impactful for me. It taught me to, sit down, listen, step back, understand an organization. So the first 90 days for me, it may not be applicable in everyone's scenario, but was really helpful for me.
Yeah, I love to read leadership books. So I'm definitely like adding that to the list. I think there's a lot of great advice that can come from those types of books. So, Antonia, thank you so much for your time. I have loved every minute of this, and I feel like we could talk for another hour easily. So perhaps at some other point, we'll continue this conversation. But huge amounts of good luck at UT Southwestern and your role with AUKUS and others. And I can't wait to see what else comes from all of this.
Thank you so much for having me, and thank you for leading the change in orthopedics in so many different ways. So I appreciate that.
Thank you very much, Antonia.